Hi there! Today we're diving into some crucial health information. Why you might want to reconsider using omeprazole for heartburn, why it's worth spending a little more on allergy medications, and the hidden dangers of statins. So stick around until the end. A quick disclaimer. I'm not here to undermine modern medicine, but it's important to be aware of potential risks and how to minimize them. Let's get started. Omeprazole is one of the most popular drugs for treating heartburn and gastritis. It works by suppressing stomach acid production, but this can interfere with the absorption of vitamin B12. Studies have shown that long-term use of omeprazole is linked to an increased risk of dementia because vitamin B12 is vital for a healthy nervous system. It helps produce myelin, the substance that protects and insulates nerve fibers. A deficiency in B12 leads to demyelation, which disrupts nerve signal transmissions and can cause cognitive issues. B12 deficiency also increases levels of homocysteine, an amino acid that can be toxic to the brain in high amounts, causing inflammation and damaging blood vessels. Another concern is that omeprazole lowers stomach acidity, which can negatively impact gut microbiota. Low acidity fosters the growth of harmful bacteria like Clostridium difficile. An imbalance in gut microbiota can lead to chronic systemic inflammation, which is linked to an increased risk of cognitive decline and dementia. This makes long-term use of omeprazole potentially harmful to brain health. Next, let's talk about corticosteroids, often prescribed for chronic conditions like rheumatoid arthritis and asthma. Research shows that corticosteroids can cause structural changes in the brain, leading to issues like disorientation, depression, and anxiety. By mimicking the action of adrenal hormones, they interact with the pituitary gland receptors, reducing control over the body's natural cortisol production and leading to excess cortisol levels. High cortisol levels can have a detrimental effect on the brain, particularly the hippocampus, which is responsible for memory and learning. This impairs the formation of new memories and weakens cognitive functions. Cortisol also promotes chronic inflammation, damaging nerve cells, and accelerating degenerative processes in the brain. This sets the stage for dementia, especially with long-term corticosteroid use. So while corticosteroids are necessary for treating certain conditions, their potential impact on the brain requires careful use and monitoring of cortisol levels. Benzodiazepines like alprazolam, also known as Xanax, are becoming increasingly common. These drugs quickly alleviate anxiety symptoms and help with sleep, making them a go-to for these issues. The primary mechanism is increasing the production of gamma-aminobutyric acid, GABA, which reduces neuron activity. While this temporarily lowers anxiety, prolonged use suppresses neural plasticity, disrupting cognitive processes like memory and attention. Long-term use of benzodiazepines is associated with doubling the risk of Alzheimer's disease. These drugs can also be addictive, making discontinuation a difficult and dangerous process. Studies suggest that using benzodiazepines for more than 3–4 weeks can increase the risk of dementia and other cognitive impairments by 15%. Therefore, it's generally considered safe to use benzodiazepines for no more than 2 months, ideally with a gradual dose reduction to minimize the risk of dependence and cognitive problems. Alternatives to benzodiazepines, such as cognitive behavioral therapy, can help manage anxiety and insomnia without medication. So while benzodiazepines are effective for short-term treatment, their long-term use should be limited to reduce the risk of cognitive impairment. First-generation antihistamines, such as diphenhydramine, Benadryl, also have a destructive impact on your brain. These medications are widely used to relieve allergy and cold symptoms. They block acetylcholine, which helps alleviate allergy symptoms, but also causes significant cognitive problems with long-term use. First-generation antihistamines can cross the blood-brain barrier, directly affecting the brain by blocking histamine receptors. This leads to sedation and slowed cognitive processes. Research shows that long-term use of antihistamines is associated with an increased risk of dementia. For example, a study published in JAMA Internal Medicine in 2015 found that continuous use of first-generation antihistamines significantly increases the risk of dementia in older adults. Despite these risks, these drugs are still widely used, especially for short-term treatment. In some cases, such as severe allergic reactions or chronic hives, they may be necessary. To minimize the risk in everyday life, It's recommended to use at least second-generation antihistamines, like loratadine and cetirizine, which have less impact on the central nervous system and fewer side effects. Tricyclic antidepressants like amitriptyline and nortriptyline are among the most hazardous drugs for the brain. These were some of the first antidepressants developed, and despite their effectiveness, they come with a host of side effects. These drugs block acetylcholine, leading to memory impairment and an increased risk of dementia, especially in older adults. Long-term use of tricyclic antidepressants is associated with accelerative cognitive decline, which is why they are generally not prescribed for extended periods. Statins are also linked to memory loss. The results are mixed, though. For example, a study published in Pharmacotherapy in 2010 reported cases where patients experienced memory and concentration issues while on statins. However, these symptoms were often reversible and resolved after stopping the medication. Other studies, such as a review of 32 studies published in JAMA Neurology in 2023, found no significant link between statin use and long-term cognitive impairment. Additionally, most studies indicating cognitive decline refer to first-generation statins, primarily simvastatin, Zocor. This drug, among other things, often caused muscle pain, so it's now rarely used. Nevertheless, despite the potential cognitive risks, statins play a critical role in preventing cardiovascular disease. They lower levels of bad cholesterol, LDL, which can build up in artery walls, causing atherosclerosis. It's important to note that for most patients, the benefits of taking statins far outweigh the potential risks, including cognitive side effects. They remain a key role in combating cardiovascular disease, but their use requires an individualized approach and careful monitoring. I hope this video helps you make informed decisions about the medications your doctor prescribes. Like, subscribe, and pump yourself and your brain. Have a great day!